Morning guys! It's a bit dark today, so about to put the light on. Looking gloomy. Yeah, so about this little guy. Just an update on Casper. He's going back to vet today because he started drooling. So we need to get these sorted out. Looks like he will have to have an anaesthetic just to check his teeth unless they know what to do. But I'm going to a brand new vet's today, brand new practice, bigger practice. So I know they won't touch him today, they'll just assess him and whatever because he's on antibiotics still. But we'll draw up a plan and see what to do once he's finishes antibiotics, because he just keeps rubbing his mouth all the time, and he's just not comfortable. So I'm changing vets. I'm going to a brand new vet because my vet's left now. So it's a new start. Transferring all my pets' records over to the new vet today, and yeah. So what I'll do is, as soon as I get back from the vet, I'm seeing a new vet, like I said, new practice, see what she says, and then I'll tell you what the plan will be, plan of action, and see what we can do. See what it is. He had no problems with his teeth, like I said, until about 6 weeks ago, and then when he went to have his pedicure, she did his bottom teeth and she cut them too short. So of course, now they're all out of whack because they're not pinching together like they should, friction to keep them down. So of course the top ones have got nothing to rub on. So of course they're going under or they're growing longer and it's irritating him and causing infections. And so I don't know how they're going to correct that because the bottom ones just aren't growing now. So whether he'll need them both removing and see what happens after that, I have no idea. So your guess is as good as mine, but I'll get going now. Get myself up there, get him sorted, and then you know the drill. I'll put the results at the end of this video. I'll put it all together, and so you'll know today what the plan will be. So and what she found and everything, and so yeah, guys, that's it for now. So I'll see you in a minute. Bye. Hi guys, just got back from the new vets and they was really lovely. She got the history back from my previous vets, all his records and everything, so she's up to date with that. And she was quite shocked at the mess that's been made with his mouth. So she corrected it. She took him in the back and she said he didn't even need sedation. So what she's done is she's used a special dental tool, burning tool sort of, and she's completely sorted the top ones out and aligned them with the bottom, because she said the bottom ones aren't growing because the top ones are too long and curling under, so there's nothing to friction on them. And what's been happening is she notices where the infections come from, his tongue is actually ulcerated from the teeth. I'm quite mad with the previous vet actually, because it's not my previous vet who's left, it was another one who trimmed his teeth about 6 weeks ago and cut them way too short. And it's left a whole lot of mess. Poor little guy, he's been rubbing his mouth, he's been drooling, he's got ulcers on his tongue. Excuse me. And so he's got to stay on the antibiotics for another week. The new vet gave him Metacam for pain relief. And I've just checked and they look really nice actually, the teeth. So we'll see how it goes. So I'm quite proud of him because he didn't even need sedating today. She just went along with the smoother thing, the smoother tool, and smoothed them all out. So she cut them now, and the top ones, so that they're perfectly straight. And she says until the bottom ones grow back, and they're not growing back at the moment, and they should have done. So she's quite surprised at. So she said until they grow back, he might need some further treatment. I think they call it burring or burning, with the same tool. So it's only a couple of minutes job where they just glide it along the teeth. And because she says she doesn't like using the clippers because they shatter the teeth. She says she's not a fan of that. So she's quite nice actually. So she says we'll try this method and see what happens. So I'm happy with the new vets now, the new practice. So what I've decided is I'm leaving the old vets, because my vet's left now anyway, as you know. So I'm going to be in the process on next week of moving all my pets over to the new vet. And it's a bigger practice as well, and it's a 24-hour practice. So it's really good if you need emergency in the middle at night or something. So it's a big hospital, you see. It's a vet hospital, which is really good. So, yeah, I'm going to move all my cats over there. And Maisie and Casper's already moved now. He's transferred everything over there, over to the new vets. So, yeah. So I'll show you later on. I'll give him the Metacam, because I'm going to let him sleep now. Because I've got to mix it with some water, she said. So I'm going to have to do a solution. And then we'll see what happens. She says monitor how he's eating, because his both teeth are short now. Well, the top ones are shorter now. She said he might not be able to grip, so she'll just keep an eye on that. Still monitor his weight every day. And if you see him struggling, then what you have to do is just blend his food up to a powder and just mix it with some water and feed him some soft mushy food for a while till the teeth correct themselves, because you've got to keep the pressure off the bottom ones at the moment, because the top ones made a right mess. So yeah, the top ones were cutting through his every time he was eating, because the top ones were overgrowing because of the mess the other vet made with the bottom teeth. Obviously, they'll cut them every time he was eating. He was cutting his tongue with the top teeth, so of course they got ulcerated. So and that's why he's been rubbing his mouth. Poor little guy. I am quite angry with the previous vets, I really am. But I must stress it wasn't my vet, the one who's left, because she's good. So I must stress that. So yeah, I'm moving everything over, and that's it. Just stay with the big practice and see how we get on with them. Because they've got more specialists. Well, they seem to specialise more with hamsters. They seem to know what they're doing. So, and as you know, my vet's left now, so there's no point staying with the old vets. So he's kind of snuggled up in there now. He's going to, I'm going to check that after when I get back. I've got to go out shopping. When I get back, I'm going to check that after if he's moved into his blue house. And make sure he's not stored everything there. I've got to make sure that he's eating the food. And I think I will blend up some of his mix as well anyway, just to give him something tonight as well. So at least I know if he's struggling with that, he's got some mushy food. So, yeah. Oh, someone asked me if I could do an updated video on how to look after sick hamsters. And so, yeah, I'll be doing that. I'll also do a video on dental problems as well, because that's a quite common problem with hamsters. So, yeah, so I'll do a video on that, work out what to do on that. So, yeah. But as I said, my next two videos is going to be the hamster food reviews. One's coming, I'm still waiting for the other one. So, yeah. So, guys, I'll catch you in a bit when he's up tonight, and I'll edit all the video together, and we'll see what he's like at taking the Metacam, the painkiller. And by then I'll mush up some food and give him a spoonful of his food, and leave some fresh in there for him to have a nibble at as well. And we'll just give him a bit of intensive care, because he deserves it, the good chap. He's been suffering now for weeks because of a mistake that a vet made, so I am really, really angry, but what can you do? So, anyway, at least we've corrected now. I mean, sadly my vet's gone, and now I'm under a new vet, so it's a new start, new beginning. So, catch you later. Right, guys, he's up now and it's night time. So, I just checked his teeth, and he's still rubbing, but obviously I think that's because of the ulcers. Poor little man. I've been really angry, well, not really angry, but I've just been really, really, really fed up over the mess that the previous vets made. It's just unnecessary suffering, it really is. And now we've got to pick up the pieces and make him better. Oh, shut up, cat, she's on her happy pills again. Now I've got to make him undergo this treatment all the time till his bottom teeth grow back. So He's managing to eat okay. I've just made him some, just grinded up some of his food and mixed it with some warm water. And he took a bit of that off a spoon as well, so I just wish he'd stop doing that though, because it's sort of really sad to see him do that. So, oh, shut up, you. So yeah, so I think that's about it, guys. Really, he's been to the new vet, like I said. I'm going to stick with that practice for now, the bigger practice, and we'll see how we go on with the little dude. She said that until he's bottom, he's having a good itch. It's so funny when they do that. Yeah, unless until his bottom teeth grow back. Sorry about that. Until his bottom teeth grow back, then he's might have to have. Well, he will have to have more of them things by the looks of it. You know, more of the dental surgery at the top. But he didn't need sedation today, like I said. She said he was very, very good. So I'm very proud of my little boy. So the main worry really is his weight, because the teeth is only a few minutes job. We can always just pop him off to vets and just keep sorting them out till everything's cleared up. And it's it's the weight and the ulcers really. She said keep on with the antibiotics because they'll protect, especially with his mouth being ulcerated, like I said before. And basically, just gotta wait and for the bottom teeth to grow back so that they'll put more pressure on the top again and start wearing them down properly. So just hold on a minute. Yeah, guys, so sorry about that. She just drives me mad when she's on them happy pills. She just squawks all the time, just saying. Yeah, so he's, like I said before I go, this is only a quick part, this. I'm more worried about his weight, really, because we've got to try and get his food down him, and we can't really force him, so that's why we might have to turn to critical care if he's, because he's only managing about 3 or 4 grams of food a day. So, well, come to think of it, even Razabi didn't even eat more than 5, so maybe it's just a draw thing. But I understand that if his mouth's really, really sore, it's gonna hurt him eating. So I'm trying to work around him and just weigh him every day and see what happens. Yeah, so keep you in touch, guys. Keep you up to date, guys, and yeah, bye. You gonna say goodbye, Casp? You gonna say goodbye, Casp? No. Bye.